I'm Dr. Birkenstock, owner of Skin Body Health in New Orleans, Louisiana and Mandeville, Louisiana. As we come to you most every week, we always want to bring to you a different topic on anti-aging, women's health, men's health, skin, beauty, weight loss, hormones, and we've also been talking a lot about what we can do in these trying times as far as trying to calm down the body and soul. And we'll be getting more into some of those issues in the next few weeks. Tonight, as promised, we're going to be talking about male hormones. So, have you noticed a change in your erectile function, in your stamina, in your strength or energy? They can all, or some of those symptoms, be related to low testosterone. And it's not just low testosterone. Low testosterone can be accompanied by high estrogen, high progesterone, prolactin, or some of the other big science words that are all about the male hormones in the body. So we don't often stop to realize that males have many hormones too. Of course, their main one is testosterone, but they also have the three estrogens, progesterone, DHEA, SHBG, prolactin, and the like. When these hormones get out of whack, different changes can happen in their body. Their erections can become not as strong. Their moods can become very sad and emotional. Their energy can go kaput, a little bit of the all, or just maybe one main symptom or the other. But suffice it to say, the old myth that men were aggressive and it was because of their testosterone it made them fight, that is a myth. What we now know is when they don't have the proper amounts of testosterone, they can get moody, angry, or aggressive, or just sad, emotional, and cry. One of the other symptoms we see in a man when the hormones aren't right is they begin to get a female type of breast, sometimes known as slang as male boobies or male boobs. That's when they're getting too much estrogen, and that's actually one sign to go to your physician and have this checked out. Yes, men do get breast cancer too, although it's a lot more rare. In a little while, I will be bringing on one of our clients, one of our successful clients in our male hormone program. As many of you know, we treat women with perimenopause or hormone issues, menopause issues, and beyond. We also treat males and male hormones. Sometimes that's a fancy word called andropause or male menopause or just low T. It's all different synonyms for the same thing. And again, just like a female doesn't have to have all the myriad of the menopause symptoms, just 3 or 4 of the whole endless page list of menopause irregularities can make a woman feel awful. Same thing for a man. So if you've got the low testosterone or high estrogen or both, or some of the other mixture and not even hormones for the male, LH, FSH, prolactin. Prolactin is a hormone made by the pituitary gland. And when that's out of whack, it's going to throw off the whole system down in the lower body with the testosterone down in the testicular glands and such. So what are some things that mess up our hormones that maybe isn't from nature? Well, when bodybuilders are injecting steroids, sometimes testosterone, sometimes other steroids, it gives them a false or a hyper testosterone state. And the body can only hold on to that for so long. So yes, you will have more muscular mass, but down the long haul, you will pay a different price. And that may or may not be a price you're willing to pay, and that is a personal choice. If someone has too little or too much thyroid hormone, that can also affect the amount and the production of not only testosterone, but the other male hormones as well. Then there are products that we use to treat prostate cancer in that God forbidden event, and some of those treatments can in fact cause erectile dysfunction and low testosterone. There are some physical maladies or disorders that can also affect erectile dysfunction, testosterone levels, male fertility, and the like. So a lot of men don't know that when they get older, if they're not keeping in shape with power walking or body lifting or swimming, biking, or any of those other exercises, they can get things like diabetes or high cholesterol or high blood pressure. Some of that will be genetic related, some of that would be due to the amount and type of foods that you're ingesting. But regardless of how it gets there, the blood pressure, the diabetes, the high blood sugar, the high cholesterol will clog that penile artery going into the organ. And unfortunately, with that male organ, it's a one-way highway, one road in and one road out. And once it gets clogged, it's almost impossible to unclog it. So the very best thing to do is to watch your health. When your doctor says your blood pressure is going up, cooperate with them and get it down. Watch your salt. By all means, watch those fried foods, butters, creamy sauces, and other things that increase cholesterol, because that increased cholesterol will send little minute particles to that artery. And again, there's one highway in and one highway out, the penile organ. And once it's clogged, there are no accessory highways. Now, it's not to say you can't build some little tiny collaterals, and everybody hopes that they do. However, once the main highway is clogged by diabetes, cholesterol, high blood pressure, and the like, it's very, very hard to reverse time. Although, of course, we do have some treatments planned. Please remember, our YouTube channel is Dr. Birkenstock Skin Body Health. We're also on TikTok and Instagram. Please like and share. Anybody that likes and share our video tonight will receive a free complimentary product of our Zinc Prime. As we all know, zinc is one of the caveats or one of the main important elements that help support male prostate health. Click the link in the description below to go to our store, skinbodyhealth.com. As always, when we tell you about a problem, we always try to give you the answers. So I will go over procedures that can help treat the male when this problem occurs, as well as male hormone therapy, which is a wonderful, natural, bioidentical hormone alternative. But for right now, let's focus on what supplements would be good if you were experiencing any of these problems with libido or low energy or lower sex drive or erectile strength. Well, what you would want to consider are three main products. Adrenal balance. And adrenal balance, your adrenal glands are very much one of your sex hormones, and one of your sex glands, as a matter of fact, and they sit above the kidney. They make all of your sex hormones in a minor amount. Of course, your organs make your sex hormones in a major amount. So what adrenal balance does, the word balance means that it balances out the hormones. So if your adrenal gland is ramped up, you're in a fight or flight state, it's either a bad weather condition, or it's a bad family condition, or maybe it's a bad economic condition, and you're ramped up, you're throwing out a lot of cortisol, which is going to increase your fat and decrease your good sex hormones. So what adrenal balance does, it adapts to the adrenal gland. If the adrenal glands are running on fire, it's going to pull them down to a normal state. If the adrenal glands are sludging and going into adrenal fatigue state, it's going to pull them up. So when it's adrenal adaptogen, it adapts to what's going on with the adrenal gland, which is one of the hormone manufacturing plants in our body. The second one that we promote in our male hormone bundle is DHEA Boost. When DHEA is low, it is the precursor to testosterone. So what we would like our DHA to do, and our product is DHEA Boost, is we like that DHEA boost for the male because it's the precursor to testosterone. So we're going to ask it to help us naturally increase testosterone without going through that estrogen highway. Last but not least, to complete the trio, the three-part bundle, is Zinc Prime. Zinc is an element that is just fantastic to support prostate health, penile health, and male health, and it's also very, very good for immune health. So our three bundles is Adrenal Balance, DHEA Boost, and Zinc Prime. Those three, the retail price of that is normal $145. It will be in our store for one complete month for $89. So this is the male hormone bundle, and it is in our store, skinbodyhealth.com. If you missed any of our previous webinars, they can be found on our YouTube channel, Dr. Birkenstock Skin Body Health. We've had a myriad of topics over the last 3 years, and you may want to go back and look at some on beauty, skincare, weight loss, aging, anti-aging, male issues, female issues, and the like. So let me go on a little bit further. So we talked about some of the things, disorders like diabetes, blood pressure, and high cholesterol that can absolutely affect the penile artery and impair the penile organ. In addition to that, alcohol and smoke. So tobacco particles, I'll pretty much simplify it. Tobacco particles can very much look and act like a cholesterol particle. So those two particles get together and go to that artery and just try to cause a highway jam and a highway backup. So tobacco and cholesterol, add in alcohol, and you've got a perfect storm. So those are some things that you want to watch. There's some other nerve disorders that can also affect male organ health, and that would be things that affect the nervous system. One example would be Parkinson's syndrome. So Parkinson's syndrome is a nerve disorder, and because that male organ functions by flow, blood flow, and by nerve endings, if you've got a nerve issue or a flow problem, you're going to have issues, may very well have issues with the male organ gland. The other things that can do this is diabetes 1 and 2 can also have nerve issues in addition to the sugar particles that clog the gland. Then you've got an electrical problem potentially on your hands, as well as a clog problem with the particles on your hands. There's a few medicines that affect the male gland, but by and large there are many options to those now, and that's not so much of an issue as it was before. So what are our treatment options? Number one, we've got Cialis and Viagra. If the issue is primarily erection, keeping an erection long enough, or keeping an erection strong enough, or both. In addition to that, and a very, very much overlooked method is a vacuum constriction device, also called a VCD. So what is a vacuum constriction device? The slang word for that is a penile pump. And there was a study in Portugal done many years ago that showed a penile pump alone, used over time, can work just as well in mild to moderate cases as a Cialis or a Viagra. So imagine that the penile organ is very much like a biceps or a hamstring or any other muscle. The organ has to be used to keep its strength. And the way that organ is used is either through human relations or by using a vacuum pump that can force blood flow into the organ, keep it there for 10 minutes, and then release. And then, of course, that would work very much like picking up 10-pound weights for someone like me to strengthen a biceps, or maybe 50-pound weights in a stronger male to strengthen the biceps, almost like curls. So don't ever underestimate the simple things, the simple exercises that we have out there. In addition to that, there are procedures that we have. PRP, platelet-rich plasma. Drew Brees actually had this in his shoulder many years ago. Tiger Woods has had it in his wrist and in his knees. Both of them prevented deep surgical procedures and were able to heal the issues that were going on with platelet-rich plasma. So what exactly is that fancy word, PRP, or platelet-rich plasma? It's when we draw your blood, we take out the bloody component and throw that away. We keep the platelets that has the stem cells and the growth factors within. We spin them down at a very special rate in a special centrifuge, and then we re-inject where the issue is. If it's a shoulder, like Drew Brees, we inject it there. If we're doing facial rejuvenation, we'll inject it into the facial epidermis skin. If it's a male organ or a female organ issue, we'll inject down below, and it rejuvenates, creates new blood flow to the organ, and can help with females with urinary incontinence or orgasmic issues. and certainly help a man with erectile issues. And last but not least are exosomes. Exosomes are derived from the amniotic fluid in the sacs that are thrown away after the birth or delivery of a baby. And they have some beautiful stem cells and growth factors within these exosome type fluid and particles, and those are injected much like PRP. So those are some of the options available, and they work very, very well. There's also some new state-of-the-art treatment on the field, which is a high magnetic power, and that high magnetic power, when applied for 30 minutes for 6 sessions over a couple of, a better part of a month, can absolutely stimulate organ strength by pulling in the muscles, ligaments, and tendons and re-strengthen them, not only for women in the pelvic floor, but also for males in the pelvic floor too. So for a moment, let's talk about the simplest form of treatment that we have. And for many, again, doesn't have to be erectile dysfunction. It can just be a decrease in stamina, or a decrease in energy, decrease or change in moods, or you're just noting a lot of plaunch belly fat, and or getting some female type or a looser sitting chest, quote unquote male breast. And those are things that are not normal for a male, and they're actually not good for male health, because that fat that sits in the tummy is the most highly related to the risk factors for cardiovascular or heart disease, heart attacks. So we want to keep that male slim and trim. So we want to keep his testosterone not ramped up with steroid injections, but at an appropriate level that keeps good male health. So I'd like to welcome up Mr. Ray. He's a client of ours. Mr. Ray has been with us several years. And Mr. Ray, can you tell us a little bit about, you've been on our hormone creams, and it's not a whole lot of cream, and you apply it in the morning. And can you tell us how it's worked for you?
It's worked very well. If I went back probably about 2 years ago, I weighed about 185 pounds. Came to Dr. B, got on some supplements, a DHEA boost, some vitality, vitamin D3, several other supplements, and then got back into working out quite a bit. And I was able to drop quite a bit of weight within a 2-year period. The cream is essentially very easy to put on. One bottle will last you for about 2 months, if I remember correctly, somewhere right up in there. And it does give you extra energy. It gives you an increased libido, without a doubt. And when she was talking earlier about genetic factors that come into play, I hit almost every one of them, right? Thyroid, high blood pressure, high cholesterol, too many sugars, without a doubt. So those types of things are, your gut health, as she was speaking about, is just as important as what the creams are. But if you use them in a combination in addition to the supplements, you will find yourself a hell of a lot better.
Well, I thank you. Thank you, Ray, for coming on. You look great. Do you know how much weight you weigh approximately?
25 pounds.
You lost 25 pounds. Well, you look fabulous, and thank you so much.
Thank you.
I do appreciate you coming. So there's Mr. Ray. He's living proof that simple medicine works. Eat right, take your vitamins and minerals, listen to your anti-aging doctors. A few supplements go a long, long way. And the male cream that we custom developed to you based on your blood work is a home run. It's one of our most popular things that we offer in our clinic, that in our menopausal hormone clinic. The males stay with us, they feel better, they lose weight, and they're not on any diet pills. We just don't need to do that here. And the important point is setting females and males back up so that their blood work is better. The proof is in the pudding. If your sugars are down, your blood pressure's down, your cholesterol is down, then you feel better, you look better, your libido's up, your energy's back, and erectile function is working strong, then you know you've got a home run in that category. It's been a pleasure talking with you tonight. We'll see you in a couple of weeks on a Tuesday. If you have any special topics you'd like to hear, please text us at 985-727-7676. Remember to visit us on our YouTube channel, Dr. Birkenstock Skin Body Health. The male hormone bundle will be on sale for a month, and it's always our pleasure to serve you. Good evening.